closed. So the way to turn it on is you'll have like this window open over here, and I think it always wants you to like open the online one before the offline one. It'll tell you if there's an error anyway. So if you hit launch, then it actually opens this window, which is the online system. And after that, if you hit launch offline, then it'll open this system where you can pretty much like see all of your results. A useful thing to note over here is sometimes you can go to report and then do edit instrument curves, and then you can add in, yeah, this one's already checked in, but sometimes it's not, is the %B. So if you ever want to know, like, you know, like exactly where your compound diluted. And this table over here will tell you like, okay, like fraction 9 was collected at, you know, like between 8.1 and 9.1 minutes. So then if I click over here and go to solvent B ratio, and then I zoom in just at like the 8-minute, mine is an isocratic gradient, so maybe it was a bad example, but same principle. So then it'll label it down here, and you can zoom in real close, and then on the y-axis you'll get the %B that it diluted as, which is helpful sometimes to have. And I think that's pretty much like all I had with this. Oh, one more thing actually. So every time you like do your injection, right before you start the post-wash as well as right before you start the pre-wash, we want to wash the loop, because whatever you injected, there's probably some stuff over here. So we want to try to remove that. So this loop is a 2 ml loop. So we usually do about 10 ml washes, 5 column volumes. And I usually use first water, then acetonitrile, and then methanol. And do 10 mils of each of them to wash it. So for that, our syringes are kept over here. So you can just use a plastic syringe to wash out, this is a syringe. You can just use a plastic one to just do wash solvents. When you're injecting your sample, you may want to use the glass ones because they are better at injecting most of your sample onto the system. So we have a 2.5 ml loop as well as a 1 ml glass loop, and this is the needle that you will use to inject, because most needles won't fit. It's a special needle that will like fit in here. So then while you're washing, I won't actually inject this because it's just air right now, and I don't want to inject air on it, but let's pretend there's solvent in here. And then you put it in here, and usually you're just like pressing this through, but actually there's a little bit of like if you like pull out and in, you'll feel some resistance. So usually when there's about 2 mils left, like if you go in and out, you'll actually see color dropping. It's the previous person's sample that's left out. It's usually either yellow or blue. And you know that you're fully cleaned out the system. So I usually like to do that as well to get everything clean. And if you're using the like HPLC for the first time, or if you're trying to do something different with a different column, like suppose you want to change it out to the analytical, this loop is a little bit finicky. It needs to be super tight and can sometimes start to leak. So then I would keep an eye on that if you change out the loop, because if it starts leaking, you're going to lose your sample, and that's not ideal. So if you want any help like doing anything for the first time, then like feel free to like ask me or anybody else like who's used the instrument a lot. It can be useful to just have somebody around like watching you for the first time before you get comfortable with the instrument. Yeah, did I miss anything? Questions? Wow. Okay, but that's it for the HPLC. We can do this feedback then. I'm just gonna turn it off.